Let's see, what questions do we have for us, Ricky? What are the biggest global health challenges we face? An easy one.
For me, one of the biggest challenges in global health is specifically the migration of health workers. If a health worker is moving from one country, low income, to a high income country, the low income country health system suffers. Governance is a huge component of the challenges in health systems.
Agreed. The health building blocks aren't hierarchical, but if you think about it, it's really governance, the political will to do something, and then the financing, and then the programs flow through that.
Yeah.
But these are massive challenges. Let's see what else. What other questions they have for us?
What do you think makes this course different?
What this course offers that I think other ones don't is that full sort of comprehensiveness. So by combining a School of Public Health with a School of Social Sciences, you're getting kind of the best of both worlds.
What I like about the program is that it is truly global. We have learning for people across the world and not focusing, say, only on low or middle income countries.
Yeah, I think that's right. These are both big selling points of our program. Well, let's see what other questions we have up there. What skills will I learn on the course?
First of all, I think it's independent learning. One of the other skills is to be able to communicate very concisely, or to be able to communicate using graphics and doing presentations, to be able to communicate orally. So I think that's a really huge part and component of the program.
And I guess there's the technical skills that they're going to get as well. So identifying sources of data, interpretation of evidence. So it's that kind of sifting of information and how to analyze information in a useful way. I think that's probably the major skill that they're going to get from this course.
So what does an ideal candidate look like?
I think an ideal candidate would be someone who potentially has a little bit of work experience behind them, that has a real interest in health, wanting to think about policies that would deliver better health. And by health, I mean the full package of health, sort of the WHO definition that includes well-being. So I think an ideal candidate is someone who has a real hunger and interest in the subject and that wants to learn. What are the benefits of this course being fully online?
From an economic point of view, they don't have to travel to the UK to find accommodation. And because the program is part-time over 2 years, they also can keep working and do the program.
I think the other real benefit of this is we're not restricted by all the kind of trappings of a normal classroom. We can use lots of different media sources, we can bring in lots of different assets into the teaching, so it just allows for an expansion when it comes to how you can pull things together into one space.
So a student might ask, how will I learn online?
That's a good question. I mean, it's much like a classroom in the sense that you will be with others, learning the same material. You will be part of discussions that are answering specific questions. There will be videos, there will be podcasts, there will be interviews with industry experts, professionals, public health policymakers, a multitude of ways of learning. Who teaches on the program?
We have people who have public health expertise. We have people who have expertise in health economics, health financing, in health policy. So there is that whole set of different disciplines within the School of Medicine that we could draw on.
Yeah, agreed. And I think a number of the people teaching on this program have a lot of policy experience too. So it's not just being good teachers and good researchers in their particular area and having knowledge from all over the world because they research all over the world or they come from all over the world, but they also have experience putting that into policy or at least being part of teams that are trying to put that into policy. So, you know, I think we bring a lot to the program and the range of experiences that we have. Okay, Ricky, what else do we got here? We got, will I get access to other institutions beyond the University of Leeds?
Oh, definitely. Governance of Global Health, the World Health Organization. There are organizations like Gavi, which are involved in the distribution of medication across the world. And as part of the program, we'd be looking at how some of these organizations are involved in either supporting decision making or the provision of services across the world.
And it's important for students to hear from those other institutions, because it's one thing what we say they do, and it's another thing for them to say what they do.
Sure.
And then we critically appraise what they say they do. Yeah, it's a nice circle.
Gareth, why are you passionate about global health? That's a really good one.
I am passionate about global health for a very simple reason. The one determinant that will decide whether or not anyone lives a minimally decent life is health, right? And without that capacity to live a minimally decent life, all other capacities are dependent.
I share that passion with you because I think global health is about having the same right to health by supporting, learning, and producing human resources for health who can actually make global health a reality.
What advice would you give someone considering applying?
I would suggest that they have a look at our website, look at the content of the program, look at the potential for career advancement that we are offering, and see if this is an area of work that they would be interested in doing.
Yeah, if you care about health and you care about the health of others, then I think this course is for you. Not for you, Ricky, for them.